Hello, friends. Good afternoon. Is anybody there? Hi, everyone. Hi. Okay, so let's go for the PSM Recall INI 2025 May 17. Okay, I'm very happily sitting in front of you because so far I could recollect around 23, 24 questions, and all questions were from the notes that we have discussed. Not even a single question. Yes, of course, there was one question, but I cannot say that is a pure community medicine question. It was a question which came out of blue from somewhere, and students were like, where to put this, whether to put it under this subject or that subject. So finally I said, okay, I'll take that burden. So that is the only reason we have one question which was not from the notes. So if we take that under community medicine, except one, all questions were from the notes that we have discussed and the classes, the hit series, CPR, everything we have done had these topics included, which came for yesterday's exam. Okay. Now, if you look at the general distribution of the questions, all were expected questions, first of all. Okay. 3 were from national programs, then 3 from family planning. This time, biostatistics, I'm very happy because usually INI means they ask more of biostatistics, but last time it was less in number. But this time, 4 biostatistics questions, expected questions, 3 from epidemiology, then from communicable, non-communicable disease, again 4, demography 1, vaccine 1, entomology 1, MCH, maternal and child health 1 miscellaneous. This is the one I said, not a pure community medicine question. Okay. Hi, Reddy. Hi. Now let's see the questions. National program. See, which of the following are included in RMN-CH plus A? Okay, the question was which of the following? So it was a multiple choice question. We know what is RMN-CH plus A. Reproductive, maternal, neonatal, child health. And A is adolescent. So under reproductive, we have family planning. So that is included. Then maternal. Yes, mothers. Then adolescent. Yes. What about geriatrics? Geriatrics is not there. Okay. So A, C, and D are included. And some students told me, madam, question wasn't like that. It was like which of the following is not included. If that is a question, go for geriatrics because geriatrics is not included under RMN-CH plus A, whereas A, C, and D are included, which I think all of you got correct. Moving on to the next one, blindness of definition. I'm sure you would have got this correct. Till recently, under National Blindness Control Program, it was less than 6/60. But now it is less than visual acuity in better eye, which is less than 3/60 after correction. So there is nothing new to tell you from this. It is a definition of blindness. With the following do not belong to HIV high risk group. If you had ever attained or if you have ever attended any of my classes before, definitely you might have seen this because in every class, invariably, I take this topic and you believe it or not, same options I had given. You will be getting something like this and then go for this as the correct answer. Okay, so same question came. We know that high risk group. See, when it comes to HIV, especially in HIV central surveillance, we divide the population into high risk group, general population, and in the middle, you have something known as bridge population, which is acting as a bridge between the high risk group and the general population. And the high risk groups are males having sex with male, it is a high risk group. Transgender, yes, it is a high risk group. IDU is intravenous drug users, high risk group. Now, what about long distance truck drivers? They are known as the bridge population. They are the bridge population and not the high risk group. Okay, so long distance truck drivers, then uh, prisoners, the prisoners in central prison, then, single male migrants, these are the bridge population. And pregnant women are taken as the proxy of general population. So these are the other MCQs which I have told you already that you should keep in your mind. And the one I always say will come for sure was this one, and the same came. So here the answer is long distance truck drivers, that is bridge population. Those were the questions from national program. Moving on to family planning. Again, expected question. Choose the best timing for property insertion. Yes, Sarita. It is with corrected power. Corrected power, Sarita. Okay. Because till recently, we were following something else. But now we have, as per what is given in WHO, same is the definition of blindness in National Blindness Control Program as well. So it is with correction. Okay. Now choose the best timing for copper T insertion. Again, multiple choice. Immediate postpartum. Yes, within 10 minutes of delivering placenta, that is one time that you choose the best timings. It was multiple choice. That means you can go for multiple options. That was something which was a speciality of this year question. You can choose multiple options. Okay. So choose the multiple options. Copper T insertion, yes, immediate postpartum. Usually within 10 minutes of delivering placenta, you can go for it. Within 48 hours of delivery. Yes, within 48 hours of delivery, that is again a good time for copper T insertion. Then within 5 to 7 days of next menstrual cycle. We know something related to 5 to 7 days, right? But it is within 5 to 7 days of menstrual cycle and not the next menstrual cycle. So it is D. So correct answers are A, B, and D, whereas this is wrong. If the question is like all except, then go for C. Okay. Minimum age for MTP in India. You know what? Actually, there is no minimum age. That is the truth. Okay. That means even minors can undergo MTP. We know that. But considering this question, after all, we have to come to an answer, right? Then we have to pick one according to some logic. And here the logic is, there is a minimum age for giving consent for MTP. And that minimum age is 18. Okay. If a person under 16 years wants to undergo MTP, then they have to, their guardian or someone who is caring for that person has to give consent. Okay. So using your logic, since we are forced to choose one answer, go for 18. Okay. Next. What is the gestational age for which the consent of 2 doctors are required in MTP? And these were the numbers given. There is a change in MTP Act 2021, right? As per that, we know. See, these are the differences. I have shown this in many places. Here the question is about advice of 1 doctor, advice of 2 doctors. See, as per the new amendment, advice of 1 doctor alone is required up to 20 weeks, right? Whereas from 20 to 24 weeks, you require the permission or you require the consent of 2 registered medical practitioners. Now just go back and see. Which one do you think is the answer? It is 24. This is the one I said, miscellaneous, about which I haven't taken this in class. But guys, as you can see, this is not a pure community medicine question. I don't know where to put this question. So I took that burden. Now we are going to discuss this under community medicine. PSM. Law related to medical data protection and safety in India. And students were like, when I was trying for the recall, students were like, Madam, there was one question. All the options were in abbreviation. So I didn't read it properly. I just ignored that question. I didn't attend it. That was the answer that I got from students. Okay. So everybody know what is P and DT, whereas this DP, GDPR, then HIPAA, majority were unaware of what these things are. Okay. So let's see. What is the answer? P and DT. You know that, right? It is preconception and prenatal diagnostic techniques. This is for preventing female feticide by prohibiting the sex determination. You know that. And during pregnancy, you're not supposed to divulge the sex of the baby. Then DPDP is nothing but Digital Personal Data Protection Act. This is recent, which came in 2023. That is why, haven't I told you, every new thing, something that is related to medicine, you can expect in INI, because they always are something very updated. So this is a new act. India's first comprehensive data privacy law. It aims to regulate the processing of digital personal data, including medical data within India. So this is the one in India that deals with the data protection. Then GDPR, something similar. Full form I have given, General Data Protection Regulation. This is for the European Union. Whereas HIPAA is something similar. Health Insurance, Portability and Accountability Act. That is for US. So the question was about India. So there is no confusion. The answer is DPDP. Okay. I hope all of you have got it correct. Now coming from demography. Easy questions from demography. Calculate total dependency ratio in a population with the following demography. They have given the age below 15 years as 6,000, 15 to 64. Some said it was 60. Okay, that is okay, because earlier it was 60, now it is 64. So it doesn't matter. Anyway, 15 to 64 is what majority told me. That was 12,000, and 65 and above 2,000. And the question is, you have to calculate dependency ratio. Now, guys, what is dependency ratio? Here, it's a ratio. That means you have a numerator and denominator. Ratio means numerator is not a part of denominator, right? And in dependency ratio, you are putting all the dependents. That means young age dependence. This is young age dependence and old age dependence in the numerator divided by, this is the old age dependence in the numerator divided by all the independents in the denominator. Okay, so this is the formula. You are familiar with the formula, right? Yes. So 0 to 14 plus 65 and above in the numerator, and the rest 16 to 15 to 64 in the denominator. Now, what are you thinking? Every single entity is there in the question. 6,000 plus 2,000 divided by 12,000, you will get it as 66.6. Yes, that is the answer. Even 60 was also there, but very specifically 66.66 was the answer. But that was okay, right? Coming from communicable diseases and non-communicable diseases were around 4 questions. An infant is brought to your OPD with scabies. As a medical officer, which of the following will you prefer as treatment of choice? Treatment of choice. Okay, we know that all these are given for treatment, right? Now, treatment of scabies. Each of this can be given actually. Okay, but the choice will be 5% permethrin, which we have already discussed. Even in infants, it is 5% permethrin, which is known as the drug of choice in scabies. This is the drug of choice in scabies. Another question. Following ear infection, a boy developed fever, facial muscle spasm, and rigidity. What is the likely diagnosis? Meningitis, tetanus, Bell's palsy. Fourth one, I don't know. I didn't get the, nobody told me what it is. These were the options that I got. Anyway, the answer is there. Which one? Ear infection. Something to do with ear. Then fever, facial muscle spasm, rigidity. So what is it? Yes, guys, it is tetanus. And what is the relationship between ear infection and tetanus? It is autogenic tetanus. Okay, we know that ear infection can lead to autogenic tetanus, right? See, facial muscle spasm, rigidity, definitely that is something which is pointing towards tetanus, right? And these are, as you can see, these are the, tetanus is also known as lockjaw, and these are the signs and symptoms that you will see along with tetanus. See, spasm of facial muscles. Okay. Clinical cure of malaria is due to, I really don't know whether this was the exact question that came. Anyway, some said it was slightly different. Anyway, this is what majority had recollected, so I'm going with this particular thing. Clinical cure of malaria. We know that all these are actually given as treatment for malaria. You know that because many places I have discussed what is the treatment of malaria. But the question is, clinical cure of malaria is due to artesunate. Yes, we give artesunate. But the thing is, artesunate is not given as a monotherapy. You have to give it as ACT. That means along with sulfadoxine, pyrimethamine is what we give, right? So artesunate is not for clinical cure. It is never given as monotherapy. Never given as artemisinin. Is that what you wrote, Harsha? Let's see. Let's wait. Okay. Never given as monotherapy. It's clearly written in the program. Don't give it as monotherapy because that can lead to resistance. Chloroquine, yes, we give. Primaquine also we give. Sulfadoxine, again, not given as a single drug along with a combination, which is sulfadoxine pyrimethamine. So we are left with two, right? So not this, not this. We are left with two, chloroquine, primaquine. Okay. Now, the clinical cure, those signs and symptoms that you see in malaria is mainly because of the asexual forms that you see in erythrocyte. And the patient becomes symptomatically, or I would say asymptomatic, because of the action of chloroquine, which is killing all the, that asexual forms which are there in the blood. Whereas, so clinical cure is mainly because of chloroquine. Whereas primaquine, see, whenever I mention primaquine, I always say two things. One, it is contraindicated in pregnancy and G6PD deficiency. And the second thing I said, it is given for radical cure where you are trying to kill all the hypnozoites which are actually hiding in the liver so that you can prevent a relapse, right? So primaquine is actually for radical cure. Since the question is clinical cure, I would like to go for chloroquine. Oh, was it multiple choice? Was it multiple choice? If it is multiple choice, then definitely we can go for all these were the options given. Any difference in the options? Anyway, we'll see it. Okay, sulfadoxine pyrimethamine was given. Was it given? In multiple choice, if sulfadoxine pyrimethamine was given, then you can also go for, if it is about the treatment, I'm not very sure what the question is. If it is multiple choice, then you can go for the drugs which are given for malaria. If the question was very specifically clinical cure, but I think the question was clinical cure. In that case, you can go for chloroquine. And guys, honestly, all these are from the recalls that I have got in the last 24 hours. It's not even, it's 24 hours. Okay. So if there is any change, I'll definitely let you know. Okay. Investigation of choice in TB spine. Again, it's slightly controversial. Controversial in the sense, there are two answers. Even I am confused. If these were the options given, were these the options given? It was about clinical cure. Tamanna is saying it was about clinical cure only. That's what, guys, I even majority said clinical cure. Okay, I don't know. This is one question where even I am confused. I can rule out two. Because investigation of choice in TB, you can rule out radiological methods. It is not X-ray, it is not CT. I'm not saying that X-ray and CT cannot detect, but the thing is, it has to go for an advanced stage 4 because early things will not be detected by X-ray and CT. So you are left with 2, which is culture and sensitivity. Okay, culture and sensitivity. Of course, you have to, it's said that you have to take a specimen. Okay, you have to take a biopsy or some specimen, and on that specimen, you can do culture and sensitivity or NAT. But as per the recent guideline, it is said that every specimen should undergo NAT. Okay, because we know that culture and sensitivity will take a lot of time for getting diagnosis. So, after ruling out one after the other, I would say the answer is NAT. Some said it was CB NAT. Anyway, let it be NAT. Okay, CB NAT or true NAT. We have different types of NAT. Anyway, the answer is NAT. Okay. Most common strains of HPV causing cancer cervix in India. Very simple, right? We know that there are mainly 4, which are 6, 11, 16, and 18, right? And in India, we have Servavac, which is the Indian vaccine that is quadrivalent, which has 6, 11, 16, and 18. Now, all these are combinations of 6, 11, 16, and 18. But out of that, the ones most common strains, out of these 4, the most common ones which cause disease are 16 and 18. Okay? And there was one question from vaccine itself. Which vaccine is contraindicated in a child with severe combined immunodeficiency? This was a question that you were expecting. On seeing this question, I'm sure you might have got the answer correct because every time they keep asking this question. We know that live vaccines are contraindicated in immunodeficiency, right? Especially in severe immunodeficiency. So we just need to find out which is the one that is live here. There's only one which is live. IPV killed vaccine, right? Yes. This is recombinant. This is again toxoid. Whereas MMR is the correct answer here because it is a live vaccine that is contraindicated. Live vaccine, which is contraindicated. Okay. Biostatistics. Easy questions from biostatistics. I'm not saying easy, but very much expected questions because even YouTube in many places I have explained these questions. So I'm sure majority would have got it correct. Choose the incorrect option. Let me just check. Okay. 16 question. What is it, Tamala? I didn't get you. Anyway, I'll come back. Okay. Choose the correct option. I'm coming to 16. I have only reached 15. Mean median. So there some names that you come across, some terminologies in biostatistics they have given, and what is it indicating is the option that you have or the term that you have on the other side. Mean median mode, something in the center, right? Mean median mode is measure of, these are measures of central tendency, right? These are measures of central tendency, not dispersion. Correlation coefficient. Don't you know that I have told you correlation coefficient is something which is depicted as small r, and r can take values from -1 to +1. And I said this minus and plus will tell you the direction of relationship between one exposure and outcome, right? So this is correct. Yeah, this is true. Squeeness. we know what is skewness. It is something which is, you have positive skewing, negative skewing, something which is showing the symmetry. Now, I'm not going into the details. You can also calculate something known as moment from skewness. Moment, they don't usually ask. Okay, it is something which we are calculating using a equation, which can be calculated from a skewness. So that is also true. Standard deviation, of course, that is something which is telling you about the variability, right? Variation. So standard deviation is also true. What is standard deviation? That will tell you on an average how much is the dispersion of the values in your data set around the central mean. So mean is central. Whereas, variability or dispersion is something which is given by standard deviation. So which is the correct answer? Not correct answer, incorrect answer. It is this one. Okay. A researcher was investigating the effect of weight loss management of diabetes, and their weights were measured and compared before and after giving an intervention, which is the appropriate test of significance. I'm so happy to see this because the exact same example I have taken for describing or explaining test of significance. So this is a question from test of significance. Okay, test of significance. Now, guys, here you have a group of diabetes. Okay, diabetic patients, and the outcome variable that you're comparing is weight, body weight. Okay, and I've told you when you are asked to choose the test of significance, that depends upon your outcome variable. Outcome variable is weight, right? Weight is taken as a continuous variable. Okay, it is a continuous or it's a quantitative variable. Okay, now guys, the thing is, if the outcome is quantitative, you can go for t-test, right? T-test. If the outcome is qualitative, like percentage, then you can go for chi-square. Okay, so here there are two tests which has t, students t, pair t. So outcome is variable. I told you that depends upon the outcome variable. If outcome is a quantitative variable like weight or height or BP, then go for t-test. Now, whether it is students t-test or pair t-test, that depends upon how exactly are you comparing. If you have only one group and you are comparing their outcome before and after giving one intervention, that means before after is always a pair, right? Before after intervention, it is a pair. So it is pair t-test. And chi-square test you do when you have two different groups and the outcome is a qualitative variable, or it is given in percentage or proportion. ANOVA, again you do for a quantitative variable like weight. But when you are comparing more than two groups, for example, if you are comparing the weight of, say, diabetes, hypertensives, and hypercholesterolemic patients, that means you have more than two groups. So here there should be more than two groups for comparison. So this is before, after. I'm just trying to give you few more MCQs which you can expect because, same might come for your NEET as well. Before, after, students t-test, two different groups. Before, after means one group. Are you with me? So these are the MCQs that you have to remember from test of significance. What was the next question? What is the use of quartile, percentile, deciles, or decile? We know that quartile means you are dividing the data set into 4 different parts, right? Percentile means 100 parts. Decile means 10. So this is 100. Now, what are these indicating? Even otherwise, you know that for your PG entrance exam, that means for your NEET, we have percentiles, right? So percentile will tell you about your position. See where exactly are you standing? Suppose you are saying that you got 50 percentile. That means compared to the first person or compared to the topper, you have scored 50% of what he has scored or what she has scored. So quartile, percentile, deciles, all these are something which tell you about your position or location. It could be location, it could even be the option position. So position or location, where exactly are you standing compared to the topper is something which will tell you, or that is what is given by quartile, percentile, and deciles. Okay, measures of dispersion. We know which are the dispersion. Standard deviation mainly. Then range, mean deviation, interquartile range. Central tendency, mean, median, mode, right? Mean, median, mode. Variation is given by coefficient of variation. Coefficient of variation. Something which will tell you about the change. Okay, dispersion, yes, especially standard deviation. So these are the MCQs that you can expect from this topic. A researcher had classified from sampling. Researcher had classified a group of people into 3 different categories. Sample size is large. Okay, Harsha. Then what is the answer? What did you write, Harsha? Okay, Prakash is saying B. For this one or the other one, Prakash? Let's see. So 3 different categories, high, moderate, low. That means he's stratifying, dividing a population into 3 different groups or 3 different strata. Categories means strata. These are strata. Then equal number is drawn from each strata. So what is the type of sampling? It is stratified. Can't you see? A big group is there. Then that is divided into 3 different strata. Is it not? And then equal number is drawn from each strata. It has to be stratified, guys. No. You cannot go wrong here. Okay. Systematic, many said systematic. Systematic means every nth person is chosen. Okay, I'll take some other color. Every nth person. Like every 5th person is chosen. Every 7th person is chosen. That is systematic. Simple random means, as the name indicates, this is the simplest form, like taking out lot. That means lottery method is coming under simple random. And snowball is not a random method at all. This is something which is used to study hidden population. Suppose you want to study the hidden population means, let me give you one example. Suppose you want to study the prevalence of STD among commercial sex workers. Then you can use snowball sampling. And it is a non-random sampling method. It is not a random sampling. It's a not random method. Okay. So these are the other MCQs from the options given. So the answer correct is stratified. Epidemiology. Very simple. Simple question to calculate the incidence. You know what is incidence? Number of new cases, right? Number of new cases. Out of 100 children in a village, 10 already had measles last year. Calculate the incidence if 20 children got measles this year. So the question is this year ka incidence. Incidence, we know in the numerator, I have already told you there are 2 terms, incidence and prevalence, right? So I've told you incidence. This is what I said there are 2 N's in incidence. So always remember new cases in the numerator. Okay. And I said, if it is prevalence, do you remember? The question is not about prevalence. I've told you. Something went wrong. I left the V. Okay. Prevalence. I said you will find all. That means all cases in the numerator will be in the prevalence. Don't you remember? So I've told it earlier. Okay. All. So all cases. Incidence May, there are 2n, so new cases in the numerator. Now, what about the denominator? The exposed susceptibles. Okay, so total population. The total population? No. At risk is the denominator. Now, what do you mean by at risk? People who are likely to develop people who are likely to develop will come in the denominator. Okay. So, new cases, there is no doubt. New cases, it is clearly said 20. Okay, we will put that 20 there. In the denominator, will you put the total population 100? Is it total population? No, it is total population at risk. Already 10 children got measles. Now, are they at risk for developing measles in the next year? No. So, you have to remove that. So, it is 20 divided by 90 into 100. You will get the answer as 22.2. So, here the answer is 22.2. Then, what is it, Yadu? IUCD question, which is not correct. Oh, which is not correct was the question or what? Okay, let me just go back. I don't actually remember where I kept that question. Huh. This one, right? Is this the one that you're saying, Yadu? In that case, this will be the answer. Okay. Because that is the only one which is not fitting. All others are correct. So, okay, Yadu Krishna, if that was the question, this is the answer. Moving on to the next. Arrange the following steps in the correct order. Again, we have discussed this. Okay. There are 4 steps given. 1, 2, 3, 4. This is how you conduct a research. Even if I haven't told you, say I have told you, you might have done research during your UG time. So you know how to go about it, right? Or for any research, you should have a question first, right? You should have something in your mind. Why this is happening? That is a research question, right? Suppose I want to know why the deaths are more in COVID for those who are above 60. In elderly, the COVID deaths are more. So when I was working in COVID unit, I had this doubt why deaths are more common in elderly people. So that is some question that you are getting in your mind. Everything should start with question, right? So this is the first step. Then I have to convert that to the research objective. Objective is the aim. I want to know what are the risk factors of death in elderly patients who are having COVID. Okay. Then I want to do the study. For that, I have to do the study in elderly people. So I have to select the population, right? Okay, then I'll go to the elderly people and I'll try to find out what are the risk factors they have, like whether any comorbidities are more or some medicines. Then after collecting the data, I will do the data analysis, right? So the correct answer is sorry, not this one. The correct answer is 1, 2. Oh, sorry. Yeah, this is the correct answer. I was actually going like this. Yeah, so this is the first step. So you start with 3. What I've written there was correct. 3, say you go to 4, then you go to 2, then you go to 1. I was actually looking at these numbers. I should look at these numbers, right? So the answer is 3, 4, 2, 1. Another very, very, very updated question. At the time of Maha Kumbh Mela, sorry, okay, Kumbh Mela, multiple mobile medical units were set up to monitor symptoms of fever, diarrhea, respiratory illness among public attending the festival. The primary aim is... Okay. Okay. So what is the answer here? See, these are mobile medical clinics. Whenever there is a festival, not only for festival, especially in those places where the public crowding happens, the government sent mobile medical units. The primary aim, I'm saying the primary aim is the early detection of cases like fever, diarrhea, respiratory illness. Because once this disease breaks out, the problem is that can lead to an outbreak, especially when there is crowding. When public people are coming together, even 1 or 2 diseases can spread like anything. Okay, so early detection of cases for preventing outbreak is the primary aim. It is clearly said that they are monitoring the symptoms of fever, diarrhea, respiratory illness. To reduce the need for medical professionals, no. Quarantine, no. Actually, quarantine symptomatics. Symptomatics are not quarantined. Quarantine is actually done for, yes, contacts, right? That terminal, that the C as such is wrong, because quarantine is done for contacts and not for symptomatics. Symptomatics, you are isolation. To provide treatment, of course, you give treatment. I'm not saying that you don't give treatment, but the primary aim is to detect the cases at the earliest for preventing outbreaks. One question from entomology, which was quite expected. These were the diseases and vectors. Match the following vectors with the diseases caused by them. Louse, tick, mite, fleas. Louse, we know it causes epidemic typhus. We know that. Fleas cause endemic typhus. So, this is 1. This is 2. What about tick? Tick. See, whenever you hear tick, the first disease that comes to your mind is KFT. Usually they ask about KFT. But this time, it is Rocky Mountain Spotted Fever, RMSF. And mite, we know mite causes, I always tell you, mite causes diseases start with S. Scrub typhus and scabies. Scrub typhus and scabies. Scrub with thrombiculid mite, scabies with itch mite. This is with itch mite. I'm just trying to give you as many MCQs as possible from this, okay? Scrub by thrombiculid mite. And I also have mentioned that scrub typhus is one question. From somewhere you will get this question. Usually you get it as an image-based question. You will be given something known as a black lesion, a lesion which is black in color. And the question will be, there will be something like a person went to, a child went into the forest or into the shrubs and got bitten by something. Doctor, he developed fever, and on examination, doctor found something like this. So what is it? That is eschar. Okay. Again, pointing towards scrub typhus. Okay. So these are the answer has to be like this. Louse, epidemic typhus. Flea, endemic typhus. Tick, RMSF, mite, scrub typhus. Okay. Then MCH. Last question. Which of the following is seen in marasmus? I didn't get the last option. Marasmus, kwashiorkor, they always ask. Right? Okay. PM with weight loss and edema. We know that in marasmus, you won't see edema. Whereas in kwashiorkor, you will see a pot belly. Right? Child will be having edema. So this definitely you will not see in marasmus. Not this. PM with weight loss. Of course, there will be weight loss. Normal serum protein. That is the correct answer. Because most of the time, some little bit of decrease might be there, but compared to what you see in kwashiorkor, the serum protein level will be kind of normal. Okay, so that is the correct answer. Swelling of body parts. No. Swelling of body part is something that you see in kwashiorkor, not in marasmus. Okay, Erasmus child will be very thin, right? So severe calorie loss and very thin. So you will not find any swelling or edema. So the answer is B. Okay, so these were the questions I could recollect in the last few hours. And I'm sure many more questions are yet to come. As and when I get questions, I'll try to update. I'll somehow make sure that it will reach all of you. And I hope this session was useful. And if you have any extra questions with you, kindly let me know. And if you have any doubts or if you want me to change the questions, because these are based on the recollection by students. So there might be, I'm sure there might be a lot of options which went here and there. So if you have any doubts, please feel free to contact me in my WhatsApp number. This is my WhatsApp number, 9895449210. Please message me your doubts. I'll definitely get back to you. And all the updates I'll be giving through my Insta page. Not just updates, I'll be giving you classes, all the important topics, discussion, everything will be going on in my Insta page. So this is my Insta page. You can follow me and I'll be available for doubt clearance there as well. Okay, guys. So thank you very much for your patient listening. I hope it was useful and all the best. Now, please stay calm and let's hope for the best. I'm sure community medicine was just like a, it was like a, what it was a piece of cake for you, I'm sure, because all questions were expected. Okay. And from other subjects, I heard it was relatively little bit difficult, but don't worry, majority, around 25 questions were from community medicine or PSM, which I'm sure all of you have got correct. Okay, guys. So bye. Take care. My prayers for your success in INI, and don't stop with this. Keep preparing for NEET because one more exam is there, NEET, where you're going to rock. Okay, so forget about this. Let's wait till the results are out. Bye, guys. Take care and all the very best.
Thank you, ma'am.